Go. Okay, hello everyone. Welcome. We're going to get started. Welcome to the Dialogue on Aging, hosted by Providence Health and UBC's Edwin S.H. Leong Centre for Healthy Aging. I'm Dr. Julia Henderson. I'm an assistant professor in the Department of Occupational Science and Occupational Therapy at UBC. I'm an investigator with the center, and I'm co-chair of Community Engagement and Intersection. Oh no, I just closed my notes. Hang on 1 second.
Been there, done that.
I'd like to acknowledge that we're gathered here today on the traditional, ancestral, and unceded lands of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh First Nations. We acknowledge that most of us are uninvited guests here on this territory. As we appreciate this beautiful location that we're sharing today, and by the way, you're welcome to wander the gardens after the event. It's included with your registration. We like to recognize the importance of Indigenous place thought, which reminds us that this beautiful land carries stories and wisdom that span deep time. The teachings of Indigenous elders and knowledge keepers guide us in understanding in understanding our interconnectedness with the land, water, and all living beings. And as we work to be ethical stewards of the environment, we honor the Indigenous commitment to protecting the natural world, recognizing that our well-being is intrinsically linked to the health of the ecosystems around us. May we move forward in a spirit of reconciliation and respect, acknowledging the profound depths of Indigenous wisdom that continue to shape our collective future and guide our efforts in environmental protection, ensuring a sustainable world for all of us who come after. Our talk today is the first in our Spring 2026 theme, Empowering Aging, Information, Choices, and Well-Being. It's my great pleasure and honor to introduce my colleague and friend, Dr. Nicole Dalmer, who's joining us from McMaster University. Nicole is an associate professor in the Department of Health, Aging, and Society and acting director of the Gilbrea Center for Studies in Aging. She received her MLIS from the University of Alberta in 2012 and completed her PhD in Library and Information Science from the University of Western Ontario in 2018. In her work, she takes up an interdisciplinary critical gerontological approach as she explores the meanings, expectations, and values of connections in later life. A multiple award winner for her research, we are just delighted to have Nicole today. There's a lot of awards listed, but I'm not going to read them all. Okay. In today's talk, Nicole will explore how older adults look for, understand, and sometimes avoid information about death and dying. She'll explore questions like, what kind of information do people want? What feels trustworthy or easy to use? And what barriers prevent people from seeking this information? So please join me in welcoming Nicole.
Testing. Is that on? Can you hear? Oh, maybe I need it closer. Okay. 2 GIFs. I'm double mic'd. I'm just trying to get this on. No, we'll put that in my pocket instead. Stop fiddle farting. Move this up. How's that? Okay. Please just give me a wave if the mic droops and you stop hearing me, please. So good afternoon, everyone. Thank you so much to the Edwin S.H. Leong Centre for Healthy Aging for the invitation to open this Spring 2026 Dialogue on Aging series. It's really wonderful to be here, and my goodness, what a beautiful setting. And I'd like to say thank you to you all for showing up today, because talking about death takes a certain kind of courage, I think, perhaps a bit of curiosity, and maybe a little bit of both. And so I'm hoping what I share today is useful, perhaps thought-provoking, and I'm hoping maybe even a little bit reassuring. And so, as Julia mentioned, what I want to do this afternoon is share some research about how older Canadians look for, understand, and sometimes avoid information about death and dying. I think the experiences of the people in my study reflect conversations many of us are already having or trying to have in our own families, our own communities, and maybe even with ourselves. And I'll be really curious in the Q&A session to hear whether their voices, which I'll be drawing on throughout my talk today, might resonate. Oh, maybe I'll just hold it. Might resonate with your own experiences. Maybe we'll do that.
An actual handheld.
Oh, sure.
I'd like to use that. And I have a stand. Yeah.
Thanks everyone for your patience. My apologies. I can hold it, it's really fine. Before I go any further, I do want to take a moment to recognize that I live, work, play, and conducted this research on the traditional territory shared between the Haudenosaunee Confederacy and the Anishinaabe Nations, which is acknowledged through the dish with one spoon wampum belt. The dish represents the land, and the one spoon reminds us that we are to share its resources and take only what we need. And I'm really grateful to be a guest on their lands. And this idea of shared responsibility is rather central to what we'll be talking about today. Preparing for death isn't something that happens in isolation. It happens in families, in relationships, and in communities. I'd also like to thank Dying with Dignity and the Completed Life Initiative for the generous support of this research. They helped fund this work and helped to create the space to ask these questions with care and with openness. And I also would like to acknowledge my research assistant, Ileana Columbi, who has been a partner in this work, and without whom we would not have been able to wrangle 230 survey responses into the findings I'll be sharing with you today. So let me take a moment to tell you a little bit about how I came to this topic, because I think it helps explain the particular lens that I'm bringing. I was first trained as a librarian, cardigan included. I've always been fascinated by and with information, how people search for it, where they go, and what they do when the information they find becomes overwhelming rather than helpful. And I'm also a social gerontologist, someone who thinks really carefully about aging and what shapes people's experiences in later life. Over the past years, I've spent a lot of time studying, for example, how older adults engage with technology. And one thing I've really learned throughout many different studies is that so many of the stereotypes that we hold about older adults don't hold up. I also teach a fourth-year undergraduate seminar on the topic of death and dying in later life. And so this study is really where these two parts of me meet. Looking at how people learn about death and dying lets me bring my kind of librarian's cap for my interest in information, who searches, how, and why, with my gerontologist's commitment to understanding the lived realities of later life. It's a chance to look closely at how people navigate sensitive information and to understand not just what they're looking for, but how they're feeling as they move through it. Because when we think about information and questions that surround death, dying, or end-of-life care, we're not just asking, what information is out there. We're asking, how do people find it? How do they make sense of it? And how do they navigate it even when it's emotionally demanding, maybe uncomfortable and even overwhelming? It's probably no surprise that talking about death can be pretty tricky. Some folks might experience what we term death anxiety, which is the intense and really persistent fears of one's own death or dying process. And even though it's one of the very few certain inevitabilities of life, talking or thinking about death or dying is often avoided, delayed, or quietly sidestepped, even when these conversations are clearly very needed. And this avoidance can leave people without the information they need when making critical and often time-sensitive end-of-life decisions. Some of you might be familiar with the term health literacy, the ability to find and understand and use health information to make informed decisions. In recent years, alongside health literacy, we've also seen the rise of concepts like financial literacy, media literacy, and digital literacy. And now increasingly, we're starting to learn about and talk about death literacy. Death literacy is the knowledge and skills that enable people to access, understand, and act on information related to death and dying. This can mean everything from making medical treatment decisions, navigating healthcare systems, understanding palliative care and hospice services, or knowing one's legal options. Across the studies, what we're seeing is that higher death literacy is associated with several meaningful and positive outcomes: greater comfort discussing death, stronger engagement in advanced care planning, and more robust end-of-life support networks. Interestingly and importantly, research also shows that death literacy develops not often through formal education, but through lived experience. Caregiving, supporting someone through serious illnesses, being part of communities that talk openly about mortality. And this matters because it tells us that death literacy, or improving your death literacy, isn't necessarily just about handing someone a pamphlet. It's really about creating community conditions where knowledge can be absorbed and used. This growing attention to death literacy is also happening against a broader cultural backdrop: the rise of what's called the death positivity movement. Seeing the number of problems or issues created by pervasive cultural death anxiety, this movement is aiming to restore death to its place as a part of life, through educating the public about the benefits of perhaps confronting and learning to accept our mortality more openly. The modern figurehead of the movement is Caitlin Dowdy, a Los Angeles-based funeral director, author, and host of the YouTube channel Ask a Mortician, which is really fascinating if anyone wants to give it a listen. Being death positive is used to describe those who embrace the many aspects of death, in a healthy, tolerant, and open-hearted way. The movement is organized around an organization called the Order of the Good Death, founded by Dowdy in 2011, which is an international collective of scholars, artists, scientists, educators, and funeral industry professionals who argue that cultural death anxiety can cause harm, and that naming and discussing death openly, honestly, and even with humor can be healthy and helpful. Death cafes, informal gatherings where strangers meet over tea and cake to talk about mortality, have emerged from this movement and now operate in communities across Canada. We've had some at McMaster and around the world. These are spaces where exactly the kinds of questions I'll be talking about today get aired openly, and sometimes for the first time. And yet, despite this growing cultural momentum, slowly growing towards openness, we still have relatively little research or information on how everyday folks going about their everyday lives navigate end-of-life information. And that's the gap that the study I'll be talking about is trying to address. One last slide on context. A lot of what we currently know about death and dying often comes from more clinical settings, or from healthcare systems and palliative care contexts. And with my little social gerontologist cap on, it often isn't speaking directly with or engaging with older adults. And this fact perhaps makes some sense when we think about the history of death and dying. For much of the last century, death has become something that's really hidden away, moved into institutions, managed by professionals, and as a result, understandably, many people feel unfamiliar with the practical realities of dying. So what do we know about how people look for death-related information? We know that when people look for information about death and dying, they don't just go to one place. They turn to family, friends, faith leaders, community organizations, healthcare professionals, and increasingly the internet. That said, access to these many sources doesn't always mean ease. People face barriers, emotional barriers like fear or avoidance, perhaps some cultural or social barriers where death is not openly discussed, and even practical barriers like navigating complex systems both in person and online. Digital access amongst older adults continues to rise and offers significant opportunities for expanding deaf literacy resources. But at the same time, digital engagement can introduce challenges across age groups, differing levels of digital literacy, concerns about information reliability and credibility, and the risk of information overload. So, the study that I'll be speaking about for the remainder of our time today really tries to respond to these gaps by centering the voices and the experiences of older Canadians. It aims to really highlight and illuminate how they navigate death-related information landscapes, what barriers they encounter, and what supports they identify as meaningful. In asking the kind of umbrella research question, what questions do older adults have about death, dying, and end-of-life care? I wanted to better understand how older adults actually find and use this information in their everyday lives, what helps, and what gets in the way. To begin to ask and answer these questions, I created an online survey with 14 open-ended questions and distributed the link primarily through social media. But before doing that, I trialed the questions with 18 older adults who are members of the Gilbrea Centre for Studies on Aging at McMaster University, just to make sure the questions made sense and landed well. To be able to participate, people needed to be 55 years of age or older, live in Canada, and be able to read and write in English. And just a quick note about that age, 55 may or may not be old, depending on where you're at. Typically, when I do research, I don't put an age. I let people decide if they are an older adult or not. But interestingly, for this study, the McMaster Ethics Research Board required that I pop an age on there, so 55 it was. Data collection took place in spring of 2025, so just last year. And we ended up having to close the survey much earlier than I really ever anticipated because we received 230 complete responses in under 3 weeks. And this is more data than I even know what to do with, if I'm completely honest, and I'm still working through it. I do want to name a couple limitations to this study before I move forward. First, this was a completely online survey. So we're hearing primarily from those who are comfortable being active in online environments. That said, StatsCan is telling us that over 82% of Canadians over 65 use the internet in 2022, and probably even more since then. And so this is an increasingly large group. Second, people willing to fill out a survey about death and dying are likely those who at least have some level of comfort, even if small, with this topic. And so this likely means that this survey isn't fully capturing the perspectives of those who may be contending with or currently navigating some higher levels of death anxiety. Our participants ranged in age from 55 to 89, a mean age of 67. The sample very much skews female, 90% of the sample, and is predominantly white or Caucasian. Folks could self-identify. It also includes participants identifying as South Asian, Chinese, Indigenous, Métis, Black, among other backgrounds. And education levels were also quite high. This is another limitation that is, for lack of a better word, unfortunately typical in gerontological research. A large proportion of research with or about older adults is still tending to be with older adults who are more of the middle upper class and who might self-identify as white. Geographically, we reached folks living in 11 out of the 13 provinces and territories. 2 of our northern territories, Northwest Territories and Nunavut, were not represented amongst the sample. We can certainly see how perhaps my own informal research networks might have shaped where the survey landed. I currently live in Ontario, where the bulk of responses came from. And I'm originally from Western Canada, so you can see perhaps how friends and family might have circulated the survey on my behalf. And because, again, of the really overwhelming, I would say, number of survey responses, I'll be focusing today on responses to 7 of the 14 questions, and focusing more so on those questions that center on content. 5 of the questions that are in the mustard yellow are those questions that ask and want to know what participants know, feel, and need regarding death and dying related questions or information needs. And the 2 survey questions highlighted in green are more contextual questions, exploring what might prompt folks to look for information related to death and dying and end-of-life care, and where participants go or who or what they consult when they have questions. Before I move into the more nitty-gritty of the findings, I do want to offer a quote that captures the spirit of many responses. And so this participants shared at one point in the survey, death and dying should be discussed as much as we plan a birth. And across the survey, participant after participant really often described death as being a natural, universal experience that deserves to be normalized. They called for earlier and more frequent conversations about mortality in our families, in our communities, and in public life. There was also this, I suppose, a call to reduce stigma and fear about death. And many said this kind of education should begin much earlier in life, not only when a crisis arrives. And this framing, I think you'll see, really runs through as this beautiful thread through what I'll be sharing today. So I'll start with a question we asked about information triggers. What would prompt you to look for end-of-life, death, dying related information? And what's interesting for many, it's very much not proactive. It's not a proactive process. It's very reactive. Across responses, we see kind of 7 distinct triggers, for lack of a better word. And I'll walk through each one and I'll draw on participants' quotes as we do so. So the first trigger that might prompt someone to start looking for end-of-life information, perhaps unsurprisingly, is a serious illness or terminal diagnosis. And this was the most consistent motivator. Whether personal or affecting someone else or someone close, a serious health crisis brought urgency and clarity to the need for information. Participants described moments when health crises forced them to confront mortality directly. Some responded simply saying, a prompt might be a serious diagnosis or, quote, if I or a loved one had a terminal illness. One participant emphasized the desire to spare family members from decision-making, saying that if they were diagnosed with a terminal illness, they would want, quote, to plan my death so that my family doesn't have to. Sometimes getting older was itself an information kind of hunting trigger, sometimes subtle, sometimes abrupt. Some participants noted that simply getting older was enough to trigger information seeking. Others pointed to milestone birthdays or perhaps to the accumulation of what they felt were maybe some health challenges. One person described how, quote, turning 60 made me think more seriously about making a will and planning ahead. While another reflected on advancing age, health problems, and yet another participant stated, quote, I'm 83. I believe I'm stuck with the longevity gene that will keep me living long past my due date, end quote. Capturing, I think, a sense of humor and resignation at the same time. And some noted that their age was motivating them to have all that end-of-life business sorted out. A third trigger was loss, the death of a loved one or perhaps a friend. Participants described how the loss of someone close, such as the death of a loved one, prompted them to search for information. Some offered kind of specific reflections stating, the death of my parents have me working to document my own wishes, or my husband's maid death in 2019 was a prompting factor. While another shared that attending a funeral and realizing I'm not prepared sparked their own planning. Others described moments of grief, such as, quote, after losing my mom, I needed to understand grief and how to move through it. Fourth, caregiving and experiences of providing care. Caregivers frequently spoke about exhaustion, responsibility, and the emotional impact of supporting others through decline, and that pushed them to search for information. Some described learning through community, saying they, quote, joined a caregiving support group and realized how little I knew about end-of-life issues, end quote. Some of these accounts really show and begin to reveal how caregiving exposes people to the complexities of decline, making mortality and quality of life issues much more immediate rather perhaps than being abstract. Others noted a distinct desire, for preparation and control. So for a lot of folks, this was almost a personality kind of attribute. They described themselves as proactive. They wanted to organize their affairs, maintain autonomy, and avoid burdening others. Some indicated, quote, I like being prepared and want to be updated on new medical discoveries, law changes, timelines. Many emphasized the importance of getting organized, noting motivations such as getting your own affairs in order or working on my estate planning and needing to explore advanced directives. I think these responses begin to highlight a strong desire for control and clarity regarding future decisions, with preparation very much framed as empowerment. I think we're up to 6 here, so one more after this. 6th is fears about quality of life, suffering, and loss of independence. And here we see how dignity and autonomy are really central. Participants frequently referenced fears related to decline, dependency, pain, or institutionalization. Concerns about dignity were prominent, including references to loss of dignity, having to deal with unbearable pain and solitude. One participant stated quite decisively, I am absolutely determined to never live in a long-term care facility. Others framed the issue in terms of personal thresholds, saying that they would seek information if my quality of life was not what I would want to continue. And I think these reflections underscore really the importance of autonomy, dignity, and comfort in end-of-life considerations, and at the same time also reflect broader issues we have with the perceived and real quality of long-term care facilities in Canada. Finally, and interestingly to me, were more of these external cues: news, legislation, community events. Some participants were prompted by these external triggers and events rather than personal circumstances. News items, local information sessions, news coverage of legislation related to MAID. Some folks said, quote, I follow MAID groups online and receive newsletters. And what I found maybe interesting as a researcher was that others noted that simply completing, quote, a questionnaire of this sort, referring to the survey they were completing, motivated them to begin the process of learning and perhaps planning. And I think these responses in this category are quite telling. Public messaging and community engagement aren't just nice to have. They can really significantly influence an individual's readiness to engage with or seek out end-of-life information. And so across these 7 kind of groupings, or these 7 triggers that might prompt someone to look for information around death, dying, or end-of-life care, what I think is becoming clear is that information seeking around end-of-life issues is deeply shaped by personal experience, one's values, fears, and external context. People seek information not only when confronted with illness, but also when striving for agency, clarity, and a sense of autonomy and empowerment. Okay, we have a clear idea about why people might start a search for death-related information, but when they start that search, what topics are they looking for? And I know there's a lot of text. I will walk you through it. When I asked survey respondents what they feel are the most critical, most important topics to address when learning about death, dying, and end-of-life care, there were 3 broad topics that began to emerge. Perfect. Okay, so in the first column we see here medical decision-making and autonomy. Participants want clarity around advanced care planning, do not resuscitate orders, and ensuring their wishes are respected even if they lose capacity. They want to feel in control of their decisions, even when they are no longer perhaps able to speak for themselves. And we can begin to see how family dynamics begin to shape this. One respondent asked specifically about, quote, how to ensure our wishes will not be overruled by frightened grandchildren or family. Second, medical assistance in dying, and you'll see this is a topic that comes up quite often. As a very brief background, MAID, Medical Assistance in Dying, is Canada's legal framework that allows eligible adults to request and receive medical support to end their life under specific legal and clinical safeguards. The legislation outlines criteria such as having a grievous and irremediable medical condition and having the capacity to provide informed consent. Since its legislation in 2016, there's ongoing public updates and public debate that are shaping how MAID is accessed and ethically understood across the country. Excuse me. Participants in our study expressed particular interest in legislative changes, especially around advance requests for those who may lose decision-making capacities, and raised real frustrations around equitable access. Oh, sorry. And so third and finally, care needs and support systems. Legal and financial planning and questions about caregiver support availability were certainly raised quite frequently. Care provision at the end of life can be emotionally and physically demanding, and several responses highlighted gaps in support for those without perhaps close family or those living in rural or more underserved areas. There are two quotes in particular that I keep coming back to in this category. The first is, quote, "What are my options if I have no family and not much money?" And the second quote, "As a rural lesbian, I want to know if I will be receiving sensitive care." And these are such profound questions, I think. They're really questions about equity and about belonging and about dignity. So that's what people kind of what they want to know. But I was curious, what do people already feel they know really well? What do participants feel they already understood well? First, they've learned a lot and feel quite competent in the area of experience, personal experiences. Many drew their knowledge from firsthand involvement in caregiving, palliative care, or the death of a loved one. These experiences provide a practical, embodied insight into what end-of-life care and dying actually looks like. Second, legal and practical planning. Participants who had completed wills or advanced care plans reported a particular, perhaps, peace of mind, a sense of having done what needs to be done. One respondent shared, and I like his framing here, "I have a list," he says, "I call it my croak list, with information about my will, financial information, pension, insurance, etc. for my son." Perhaps we can all make some croak lists when this is done. Third, healthcare processes and rights. Some participants were very confident navigating MAID eligibility, palliative care services, and patient rights, often because of prior professional experience or sustained personal engagement with these systems. And I think what we're beginning to see here is that depth of understanding and depth of feeling comfortable, I suppose, with different information topics varies enormously depending on exposure, circumstance, and initiative. Okay, I think this is correct. So that's what people felt they understood very well. I also wanted to understand what folks where they wanted more information, where they felt less informed, where they felt more uncertain, perhaps, or underprepared. Interestingly, you notice on the slide prior, some folks felt very comfortable and knowledgeable about MAID. We also see that a lot of folks had a lot of remaining uncertainties and questions about MAID, particularly around scenarios where decision-making capacity is lost and around questions of fairness and consistency of access. Palliative and hospice care were also quite poorly understood. Questions arose about the differences between home-based, community, and inpatient services, as well as around symptom management. One respondent, I think, put it quite plainly: how does one get access to hospice? And another asked, I want to know what hospice care looks like at home versus in a facility. Legal, financial, and advanced planning was a third area of persistent uncertainty. Even participants who had some documents in place were often perhaps unsure about their validity across province or care settings, which can be a challenge in a country as, I think, geographically and jurisdictionally complex as Canada. And I think these gaps point to something more structural rather than individual. We have questions because there are perhaps some gaps in the systems that we're trying to navigate. Motivated folks are navigating a very fragmented, unclear, and sometimes inaccessible information landscape. And lastly, I'll just quickly go through what people felt comfortable searching for. So we've gone through what they know well, what they don't know well, but there's also this element of kind of comfort, especially around these sensitive topics. Comfort was highest with practical, perhaps unsurprisingly, practical and informational topics: wills, cremation or burial options, advanced care directives. As one participant put it quite eloquently, it's easier to look for answers about factual topics like burial options than to confront someone about their feelings about death. Medical information and care options were also generally approachable, and emotional and spiritual support, including grief counseling and spiritual care, were areas participants felt comfortable exploring. As one participant said, quote, "I often literally search for quotes, poems, or writings about grief and remembrance." Another said, "I prefer to learn about spiritual and philosophical perspectives on death. It helps me make sense of it." Comfort certainly dropped, and perhaps this is where we begin to see some of that information avoidance, when topics became more personal, more emotionally raw, or more socially fraught. Stories or descriptions that triggered painful memories were often avoided. Medical details about the physical process of dying made many uncomfortable, and funeral, burial, and after-death logistics, though practical on the surface, we certainly saw some people on the previous slide comfortable searching about this, could be emotionally difficult or culturally loaded, sometimes leading to family disagreement. One participant said, "Considering green burial versus cremation, unsure about how I feel and if my family would support it." And I think what this tells us is that readiness or comfort with this type of information is certainly not binary. It's not a fully comfortable, fully uncomfortable. People really move in and out of it depending on perhaps timing and the type of information as well. We have covered quite a bit of ground already. Thank you for journeying with me. Before moving forward, I wanted to maybe step back and take stock of what's already been shared, starting to bring things a little bit together. First, there's a very strong desire for medical decision-making and autonomy, and I think that has really rung through. Participants emphasize the importance of being able to control their care, organize their legal and administrative affairs, and make final decisions in ways that reduce burden on family members. Information here is agency. Second, concerns about access and equity were pronounced. Many participants voiced real anxiety about navigating the healthcare system, understanding the ever-changing MAID legislation, and finding reliable services that reflected their identities, geographies, and circumstances. The information landscape is uneven, and people are not equally equipped to navigate it. And finally, third, emotional readiness emerged as a really important dimension. While some participants sought information proactively, others deliberately avoided certain topics, felt overwhelmed by it, or relied on trusted networks to guide them. The survey makes clear that readiness is not just about having documents in order or decisions made. It's about feeling supported, understood, and seen with one's social, familial, and healthcare context. And I think together these three insights point, in the very middle of that beautiful Venn diagram, an urgent need for clear pathways, more inclusive resources, and compassionate, identity-aware communication that meets older adults exactly where they are, whether they are in rural or urban locales, partnered or single, queer or straight, deeply spiritual or quietly uncertain. I'm just going to take a quick sip of water. One moment, please. So, the last question we'll be exploring together is one that I find quite fascinating. When you have questions about death, dying, and end-of-life care, what are your information sources? Where are you going? And before I list kind of those main sources, you'll see how the elements from the Venn diagram we saw before are shaping the information pathways, the sources that people decide. The desire for autonomy drives many towards self-directed research. So relying on oneself or perhaps one's very trusted networks. Concerns about access and equity shape whether individuals rely on clinicians, community resources, or online tools. And then that third Venn diagram circle, emotional readiness, can influence whether people seek out trusted family, spiritual advisors, or perhaps avoid the topic altogether. And so where people go for information reflects not only what resources are available, but how people's values, circumstances, relationships, and comfort levels shape their choices. For many participants, healthcare professionals remain the preferred and most trusted source of information. People described going to a medical practitioner, their healthcare provider, or a palliative care specialist. At the same time, these expressions of trust were often immediately complicated by some sense of frustration. One person noted that they would go to their doctor, quote, if you can ever even get in to see him. Another added quite bluntly, again, these were anonymous responses, I don't like or trust my doctor. These responses, I think, highlight a tension that runs through Canadian healthcare that I must say I'm so grateful to have. Clinicians are viewed as authoritative, yet access barriers and uneven expertise in end-of-life communication can limit their perceived usefulness. Perhaps unsurprisingly, the most universal information source across the dataset was the internet. Heading online or using Google, which one person wrote, yep, LOL, with others stating plainly, I would just search the World Wide Web. Some shared that they would look for reputable medical websites like the Mayo Clinic or provincial health authorities. Others relied on disease-specific organizations, online support groups, hospice blogs, and some were even starting to turn to AI tools like ChatGPT. And this was a year ago where things were just kind of getting hot. This widespread digital searching reflects both autonomy and necessity. The internet fills gaps left by inconsistent healthcare access and a lack of centralized, user-friendly end-of-life information repositories. And I just want to spend a tiny bit of time elaborating on what participants shared that made online searching so valuable to them. First, convenience and flexibility. Online reading allows people to engage with the topic at their own pace in ways that feel manageable. As one participant said, I can do it in my own time and stop when I want. That ability to stop is especially significant when that content can be so emotionally charged. Second, privacy. Death and dying, unsurprisingly, were often reported as very deeply personal topics. Participants appreciated being able to explore them in the privacy of their own home without needing to discuss them publicly or expose their emotional reactions to others. And for many, it's this being able to cultivate privacy is what allows them to engage with the information in the first place. Third, credibility, which can be debatable depending on where you're going online. Participants actively sought out what they saw as trustworthy sources. Again, the Mayo Clinic, a local university, and provincial health authorities. And I think we can see there's really an appetite for evidence-based, professionally validated information. Fourth, the internet also, for folks, what made it attractive was this allowance of a breadth and diversity of perspectives. The internet offers not only facts, but stories and lived experience. As one participant said, I really appreciate access to a variety of resources from around the world. And I think this reflects a need for this combination of kind of informational and experiential learning. Fifth, autonomy and self-education. Participants described wanting to independently explore their options, especially around end-of-life rights. I think comments like, I can do this on my own, so I can look up things on the internet on my own, really highlights the role of online learning in fostering and respecting one's own agency. And finally, and importantly, I think to flag, a smaller group acknowledged the real limitations of trying to answer their questions through online sources. They pointed to unreliable information, websites that are difficult to follow, and too much possibly conflicting information. Digital literacy remains an important factor in how people navigate this material. Not everyone can evaluate what they find with equal competence. Too far. So we're returning now to where people go when they do have questions. Third were community-based resources. Community-based organizations played significant roles in participants' information practices, attending talks or workshops, visiting their public library, or seeking support through caregiving networks. These spaces provide not only information, but also emotional support and practical guidance, I think making them quite a vital component of community death literacy. Family, friends, and peer networks. Informal social networks such as family, friends, neighbors, and peers were another central source of information. Participants described reaching out to family or friends who've gone through similar experiences. And one person wrote simply, "I call my sibling. We talk about our parents' care a lot." These relationships offer trust, shared experience, and emotional safety that are especially important when discussing topics as sensitive as dying and end-of-life care planning. Spiritual and religious advisors were also essential for many respondents. Folks referred to their priest, their church, their temple, their pastor or spiritual advisor as being trustworthy. Another noted that my first instinct is to pray or meditate on it. And these responses reflect this existential dimension of end-of-life questions, a space often underserved by the medical system, but perhaps needing to be still deeply supported in spiritual communities. For many folks, dying is not solely or perhaps exclusively a medical event. It can also be a spiritual one. And we need to remember this when we're designing or thinking about end-of-life care information. Legal, financial, and funeral professionals also appeared quite frequently, consulting lawyers, financial planners, funeral directors when they needed guidance on wills, estate planning, or funeral arrangements. One person noted that their funeral director was very kind, highlighting, I think, that emotional labor that a lot of death care professionals provide. Funeral homes emerged as very approachable sites for information. Several participants relied on funeral home websites or spoke directly with directors for clarity around costs, cremation options, and administrative processes. And I think there's something worth noticing here. The people who work closest to death, those who see it every day, are often amongst the most comfortable talking about it, and therefore perhaps among the most useful, for lack of a better word, resources for families who are trying to navigate it. And finally, we see the question marks there because there were quite a number of participants who quite bravely, I think, expressed avoidance, fear, or uncertainty. They shared, quote, "I haven't gone anywhere. I try hard not to think about it." They said, "I don't know." They said, "Not really sure." These responses remind us that readiness profoundly affects whether, when, and how individuals engage with end-of-life information, and that no matter perhaps how good or handy our resources are, not everyone is ready to use them at a given moment. And avoidance, I want to make clear, I don't think avoidance is indicative of indifference. I think it's avoidance is just a sign of how much this information actually matters to them. So taken together, older Canadians are navigating end-of-life information through a very complex, hybrid ecosystem that includes medical professionals, digital tools, community organizations, legal and financial advisors, business professionals, spiritual guides, and personal networks. Their choices are shaped not only by what resources are available, but by deeply personal values, lived experience, emotional readiness, and even digital literacy skills. If you will humor me, I would like to wrap up by offering some reflections. And part of these reflections have to do with perhaps rethinking this concept that I introduced at the beginning about death literacy itself. The concept of death literacy emerged in the early 2010s from Australian public health scholarship. It was formalized by Noonan, Horsfall, Leonard, and Rosenberg, who first articulated death literacy in 2016, in an article on the left there. The Death Literacy Index in 2022 on the right provides a tool, an assessment tool, to evaluate people's comfort and confidence with death-related matters. And I think death literacy is a useful concept. It names something real, but I do want to push back gently on how it's applied based on what the older adults shared in this survey. Many literacy frameworks, including health literacy, digital literacy, and now death literacy, adopt what we might call an individual skills deficit model. This is very wordy. The assumption is if people simply knew more, the barriers might disappear. If they simply had the right combination of information, all questions would be met. But as many have argued, these conventional literacy frameworks focus on individual skills, which can inadvertently shift responsibility, perhaps, and blame onto individuals for improving their literacy, even when there are much broader structural, cultural, and contextual factors that can be real barriers. The Death Literacy Index itself, though a valuable tool, has received feedback that it needs more inclusive cultural and spiritual content and needs to capture more nuanced understandings of what death literacy means across different communities.